I'll start now. Good afternoon, everyone. Om Dhanvantraye Namaha. I am Dr. Geeta Pottu. Today we are conducting 39th webinar series. On behalf of Raaauos, I'll welcome you all onto this Raaauos platform. Today we'll start the session with a prayer by Dr. Kanchana. Over to you, Kanchana.
Thank you, Dr. Shakuntala ma'am. Thank you, Dr. Geeta. Om Namami Dhanvantari Adidevam Surasurai Vandita Padapadmam Loke Jararubhayam Mrityunasanam Dhataramisham Vividaushadi Nam Dhanvantari Ramanatam Sarvaroganivarakam आयुर्वेद प्रवक्तारं वन्दे पीयूषदायकं सर्वे जनाः सुखिनो भवन्तु ॐ शान्ति शान्ति शान्तिः.
Thank you, Dr. Kanchana. Now I request our Raaauos founder, Dr. Shakuntala ma'am, to say a few insights about our group.
Om Shri Dhanvantare Namaha. I welcome all delegates for 39th webinar of Raaauos team. I'm really happy that Dr. Kavitha madam, because madam is she's very busy. In spite of her busy schedule, she accepted our request, and here she is here to share her knowledge to Raaauos members and for outsiders also, like, because it's a family of Raaauos. What I want to say, why I'm telling this family, because in the Raaauos groups we are conducting many more activities and we are supporting each other. And Raaauos is, as all many seminars happen, what is the description of Raaauos? Raaauos is Rudra Arbuda, Ayurveda approach and one shelter. As name suggests, the Raaauos intention is to bring all the Ayurvedic oncologists under one shelter to share their knowledge, to build a bridge in between Vaidyas, our Ayurvedic Vaidyas, and our Ayurvedic oncologists. Because when our Ayurvedic Vaidyas knows that our Ayurvedic oncologists are here, they are perfect, they are treating the diseases, then we can easily refer them and we can have the conversation with our own. When we are having our own Vaidyas, we have got different confidence, and we know our medicines are wonderful because they treat the root cause and they care in the end stage also. And what the Raaauos is here, Raaauos conducting many webinars like this online, and recently we have conducted one workshop also, and we are conducting online and offline awareness regarding cancer for the public. And we are going to, if at least 30-40 members are also there, we will go there and we will tell what is the exact reason of cancer, because of nowadays so much fast life and IT life, many people are catching up this cancer very early, and many more are coming. We are getting many more cases. To cut down that, we are doing the awareness program. There we will teach about our main basic dinacharya and rutucharya, and apart from that we are conducting screening camps, and we are conducting educational trips. Educational trips is that if one Vaidya is doing cancer treatment, other Raaauos preparation and other excellent emergency preparations, we will go and we will have on 3-4 days, and we will go there, we will sit with them and we will learn from them. This build a bridge and confidence, and there is a communication communication development will be there, which is very needed for this time. And one more exciting Rasashalas we are having cross team. Every month we will join in one place and we will conduct, we will prepare our own medicines for our own clinics. This all the things are happening, and for this biggest support is our admins group, and which are taking care of all the activities of this Raaauos team. And once again, I welcome all delegates and thank you so much for your support. And now I hand it to for this session to Dr. Geeta. Thank you, Geeta.
Thank you, ma'am. Thank you for the info. Now I welcome Dr. Kavitha ma'am. Now, today's speaker's introduction by Dr. Nivedita. I request Dr. Nivedita to introduce today's speaker.
Yes. Dr. Kavitha C has completed undergraduation BAMS course and post-graduation MS in Shalyatantra course from Government Ayurveda Medical College, Bangalore, which is affiliated to Rajiv Gandhi University of Health Sciences, Bangalore. Currently working as professor in the Department of Sharira Rachana at KTG Ayurveda Medical College and Hospital, Bangalore, and has vast clinical experience of 20 years in treating various diseases through Ayurveda. Also working as Chief Ayurveda Oncologist and Ayurvedic Surgeon at Ayurdhama, a multi-speciality Ayurveda clinic, a specialty Ayurvedic cancer care clinic, and Ayurvedic anorectal clinic at Rajarajeshwari Nagar, Bengaluru. She is the specialist in treating different types of cancer like breast cancer, cervical cancer, endometrial cancer, ovarian cancer, colon cancer, prostate cancer, blood cancer, etc. through Ayurveda, and also she is the specialist in Ayurvedic Kshara Karma and Kshara Sutra treatment for piles, fistula, and fissure. She has treated more than 1,000 cancer patients through Ayurveda Anushastra Karma, parasurgical procedures, Shamana Chikitsa, Ayurveda palliative care treatment, and through Ayurvedic Panchakarma treatment, which is detoxification. And she has presented many papers on national and international conference on management of cancer through Ayurveda. She has given many radio and television talks on various Ayurvedic subjects to public, and she has also conducted many Ayurvedic health camps and cancer awareness camps across different parts of the country. So this was the brief introduction about our today's speaker, Dr. Kavitha. Uh, so handing over to Dr. Geeta Pottur.
Thank you, Dr. Nivedita. Before starting the session, I request everyone to mute the gadgets to avoid the interruption. Okay. And now I request Dr. Kavitha ma'am to start the session. Welcome, ma'am.
Namaste. Ragaadirogan satatanushaktan nasheshakaya prasrutan nasheshan ausukya moharatitan jagana yo apurva vaidya namostu tasmai. Good afternoon to everyone. Today the topic is cancer caring women. The cancer problem is more in women, and they face many challenges when it comes to cancer because they have biological changes and also medical effects and psychological concerns. When it comes to the case of breast cancer, when we think about breast cancer, this mastectomy, when they want to remove the breast, and the side effects of chemotherapy and also the radiation therapy, they will be very afraid, and they think that these emotional psychological problems are increasing because they are concerned more about, because of the stress they have these problems. So we have to think about the stress, and we have to manage the stress. So breast cancer is the second most common cancer in women, both in terms of cases and death, which is estimated 2.3 million new cases diagnosed in 2022 alone. And estimation says that by 2030 in India, incidence of breast cancer will be increasing, and it will be approximately 200,000 women will be affected. Other common cancers in women include lung, colorectal, cervical, and ovarian cancer. Because of the stress, the women are suffering more from this cancer. Usually the adult women are more prone to this breast cancer and ovarian cancer and cervical cancer, and because they have the tapatraya, I will say, because nowadays most of them has to handle the home and also the office, and also about the kids, the studies of the kids, and also about their education. So handling all the three things together will cause more stress to the women, and they should be able to manage the stress by changing their lifestyle. See, the cancer is mainly, it is a lifestyle disorder. So always one should think of changing their lifestyle and should follow the healthy habits. So while cancer impacts women of all ages, especially the older women, and higher risks of developing certain types of cancer. I told it's breast cancer is most common in nulliferous women, and adult women are more prone to this breast cancer. And lung cancers, it usually comes as a secondaries. If the patient is treated for breast cancer, after 3 years, if they have followed the all protocols, like after surgery they have done the radiation therapy, chemotherapy, after all these things, the recurrence rate is more in this treatment, and usually it affects the nearby structure like lungs, or sometimes it may also affect the cervix or endometrium also. So breast cancer means it is the breast begins to grow out of control. The cells in the breast begins to grow out of control. These cells usually form a tumor that can often be seen on X-ray, or we can felt as a lump. Sometimes we can see that in thin patients, they will identify as a small lump, and they will come saying that they have a small lump in the breast, and they will come for examination, or they will consult a gynecologist or doctor. But what happens in an obese patient, if they are fatty and the breast is fatty, they will not be able to identify the lump. So they will be asymptomatic, and they will not identify in the early stages. So it will further lead to the metastasis. The tumor becomes malignant when it spreads to the surrounding tissues and causes metastasis. So breast cancer occurs almost entirely in women. We can see that 98% of the patients are women only, but I have treated one case, the men having the breast cancer. Usually 2% of the cases of breast cancer can be seen in men. So whenever we think about breast, it usually consists of a fat, glands, and connective tissue. That is, it is made of a fibrous tissue. Always it will be firm, and after the delivery or breastfeeding, and after giving birth to many kids, after breastfeeding, the breast becomes loose and loses its elasticity. The breast has several lobules and divided into many lobules, where it ends in the milk glands. And tiny ducts run from many tiny glands and connect together. See, always the breast should be soft. So when there is a changes, when there is a hardness starts increasing, or when you feel that the breast is hardening, then you should always think that you should make it soft by some of the treatments that I will tell it in next at the end. Okay, so always you have to see that the breast tissue should be soft, so it will not develop the lump, or any other aggressive changes will not take place. So usually we see different types of cancers, that is ductal carcinoma we say. Usually ductal carcinoma occurs in ducts of the breast, but it is very aggressive, it spreads very fastly, and we have to treat it very soon actually, and we should not ignore it. Sometimes what happens when a patient comes to us saying that they have a lump in the breast, we think that it might be fibroadenoma or all those things, and we ignore and we start treating the patient. After few days, or after 2 months or 3 months, sometimes it will aggravate, and it may lead to the malignant tumors. So always it's better when they say there is a lump in the breast to do FNAC, or you have to do the breast examination properly. Then you have to do FNAC. In that we have to confirm that whether it is a malignant tumor or a benign tumor. Then we have to treat that properly. Always it is better when there is a lump in the breast, get treated, or it should be removed. So this is the sites where we can see this breast cancer commonly occurs. Usually have treated this outer quadrant of breast. 25% cases usually most commonly seen is this, and 8% upper inner quadrant of the breast. I have seen lot of cases in this upper quadrant, and lower inner quadrant also I have treated many cases, and nipple and areola. So it is called as a Paget's disease. So that sort of cases also I am handling. When it comes to the causes, always we should think of family history. See, it is always hereditary. So when a patient comes saying that, usually when mother is diagnosed for CA breast, the daughter usually have the fear, and they will come to us saying that whether it is hereditary or it is going to spread. It is we are getting to affected, or all those things they will have in mind. But usually the family history, when we take for example, when grandmother had a breast cancer and a ovarian cancer, and she died because of that. It is Angelina Jolie. I think everyone know about that. Angelina Jolie's grandmother died because of ovarian cancer and breast cancer, and her mother was diagnosed at the age of 60. She was diagnosed for breast cancer, and she was also died because of the breast cancer. Her aunt was also diagnosed for breast cancer. So because of all these things, she had a fear, and she underwent a test called BRCA 1 and BRCA 2. In that BRCA 1, she got 60% chances of getting the breast cancer. So because of that, she underwent prophylactic mastectomy. Prophylactic mastectomy means the patient, if they are not having the disease, but because of to prevent the disease, she removed both the breast and reconstructed the breast in 2013. In 2015, she once again removed the ovary, that is salpho-oophorectomy, because always I told, when there is a CA breast, usually after 3 years, or we can't say in how many days, but it usually affects the ovaries. So because of that, she removed in 2015 the ovaries also. So it is, by this we can come to know that usually family history is very essential, and hereditary factors are more prominent in this breast cancer. But usually, according to Ayurveda, if we consider, we can take that family history, or genetically, we can take it like 25% only, all this family history, but 75% will remain in our hands. So whatever the lifestyle and the activities, dinacharya, ritucharya we follow, because of that, we can also prevent the cancer if it is hereditary also. So not having children. So I told, when usually in the beginning, when I started treat the cancers, most of the patients were nulliparous women only. In early olden days, I think there used to be more kids, and in families 6-7 people used to be there. In that, the elder daughter used to have some family responsibilities. Because of that, they would have not married, and they would look after all the family and everything. For this, I can give one example. One patient, she was a principal in Carmel Convent, Bangalore. She came to me saying for the treatment of varicose veins. But while treating the varicose veins, I told her to get venous Doppler done. But I asked her whether she has did any investigation. She told in her life she was nearly around 58 years. She told, I didn't do any investigation till now. Then I thought, okay, we will do all the routine investigation. In that, mammogram was also included. And after the investigation done, by seeing the results, I was astonished, because it was the first stage of cancer. She didn't have even the single symptom also, and she was not able to palpate the lump also, because the breast was obese, and she was also obese. So always investigations, early diagnosis is very important, because so earlier I used to think while practice 20 years back that doing investigations is not so much essential unnecessarily. But after seeing this case, that first stage of breast cancer was diagnosed just by doing the mammogram, I felt that we have to diagnose the breast cancer early, so that we can give treatment and they can be healthy. So having first child after age of 30, this is one big problem. Now I think we can think about that. Now the marriages are happening after the 28, 30 years. And usually nowadays, I think they want all the, this husband and wife want to settle everything. They want to buy the house, they want to buy the car and everything. After that they will plan for the kid. But here is the alarming this thing, because if you have a conception, the first conception at the age of 30 years, so that will cause, you will have more chance of getting the breast cancer than a nulliferous woman. Even also we can consider here the abortions, the miscarriages also. So if there is a miscarriages which happens at the third month or fourth month, there will be changes in the breast also has happened, but the miscarriages has happened. But what you will think, so it has happened and you will not do any diet and other things. But after some years, the hormonal changes will be there at that stage only, and breast enlargement or some veins and other things will be changed, but it will affect after few years or after many years. You will get breast cancer. I have seen many cases. I usually in the clinic I will take the try to find out the cause for the this breast cancer. Usually I will take the history and everything. So usually in many cases I could see that because of the miscarriages, they had this breast cancer. I could not find any other things. And also some people will, because of the stress, chinta, so all those things, they will get breast cancer. So radiation therapy, sometimes what happens, you might be treated for lung cancer and the radiation therapy will be given to the chest or any upper body. So it might cause as adverse effect, it may result in damage of the cells. So it may also cause the breast cancer. So overweight or obese. See, overweight or obese is sometimes what happens if we are active. So the cells will be very active and it will not cause any damage to our tissues, or it will not result in any disease. But what happens if we are not doing any yoga, exercise or something, and because you consider this overweight.
Hello, some disturbances are there. Please mute your gadget.
See, usually ladies, the hormone changes will take place at the age of menopause, and sometimes usually at the age of menopause and at the age of menarche. At the age of menarche. So sometimes what happens nowadays, because of the stress, they have to manage all office, home, everything. No, because of that, the hormone imbalance is more at the age of 40, 45. Now many people come saying that they have PCOD problem, thyroid issues, and all those things. Nowadays, the endocrine imbalance is most common, and because of that, they will have this obesity or overweight. If overweight is there, I told no, we can't palpate the breast. Because of that, we will miss the lump in the breast. We will not be able to identify. And sometimes what happens, even in menopause, we will have some hormonal imbalances. So because of that, they will start taking some hormone pills and other things. So you should not use more hormone pills and all those things at the menopause stage. It will also lead to breast cancer. And using the contraceptive pills also, that will also lead to the hormonal imbalance and lead to the breast cancer. Diet which is high in saturated fat. In breast, while treating this breast cancer, I could find that whenever we take the ultrasound scan of the abdomen and liver function test, we will find that there will be a change in the liver function test, and also there will be a change in the fatty liver. Second degree fatty liver will be found in the patient who is having breast cancer or ovarian cancer. So we usually, patient also says that before identifying the cancer, they will be identified this fatty liver second grade or third grade 2 months back. After that only they are able to confirm about this breast cancer or ovarian cancer. So sex, I already told that usually 98% of the females are affected. Only 2% of males are affected. Symptoms. So always we can look. So always after taking bath, always we should observe in the mirror and we should do the self-examination. Early diagnosis, we can cure or treat the breast cancer easily. See, prognosis of breast cancer is very good actually. So, but we should be identified in the stage 1 and stage 2. Say if you examine or stand in front of the mirror and self-examination if you do, you can find a small lump. Some patients will come to us who are very thin. They will say that a small lump in the above the nipple or below the nipple. They will come and they will say after examination, then we will send for the ultrasound or mammography. In ultrasound we will, when we get to know about the lump, then we will tell them to do the FNAC. And when it is confirmed, then we will do the this mammography. So all those things, depending on the stage wise, if it is only in the first stage, we will do all those things. Then if it is spread to the further structures, like we can see the changes, skin changes, there will be a small wrinkles over the breast region we can see, and you can see that nipple retraction will be there. When we look into the mirror, you can see that nipple retraction will be there. It will be pulled inside. So and redness, sometimes there will be redness and rash. See, whenever any patient comes, I think 1 week back, one patient, she was having a 2-year kid. She came to me saying that there is a inflammation, the breast is swollen like that. But earlier she also went to gynecologist. She showed there, they also told to do the FNAC and even the ultrasound, everything. In that, nothing they could find. It is like benign. But she came saying that after taking some medications also, it was not reducing. Then after examination, breast examination, I could see that there was inflammatory changes. The breast is had pseudo orange this thing, and inflammation was more and redness was also more. Then I gave her the application, the Shangalepa application, and internally Shiva Buttika and some medicine which will help to reduce the breast inflammation. And here you can see that dimpling and dripping also. Sometimes there will be a dripping of small secretions or oozing of secretions from the breast, you can see. So breast cancer now it's increasing. I told it. So one thing is always because of the stress. But nowadays, this modernization has made the women to they are consuming excessive alcohol, and also we can see that they are using, they are smoking, and all those things also leads to the breast cancer, risk of breast cancer. And you can see that in the dense breast, the changes we cannot find out easily, and the changes will happen very soon. Some people, when patient comes to us, say that if it is metastatic stage, they will say that, oh, if we would have come 6 months before, I think it would have been in first stage, so that we can completely cure, like that they will think. But in cancer, we can't say at what time it will be metastatic or it will be triggered. We can't find out. It is a silent killer, we can say that. In the starting stage, sometimes it is very lucky enough if you are able to identify it in the first stage. It is a silent killer. Usually, most of the obese women or most of the women will ignore simple symptoms, and they will be able to identify only at the metastatic stage. At that stage, it's very difficult because they have to undergo the chemotherapy. So this is very difficult, and recurrence rate is more after the treatment, protocol treatment also. So here you can see that redness and swelling is also present. And nowadays we can consider that early onset of menstruation. I think in my clinic I never suggest anybody to take milk. Now I consider it as the first enemy or first poison in this earth, because to get more milk, what they do is, I have seen in Chamrajpet near my clinic, there was many cowboys were there. They used to give hormone injection, so that if the cow is giving only 10-liter milk or 15-liter milk, by giving hormone injection, they used to make it 25, 30, 40 liters. And see, when only to certain years it can give milk, whole life it can't give the milk, no. So the cows, so they use always this hormone injections to increase the yield and to make the cow to give the milk. So we are not drinking the milk, we are drinking the hormones. And even when we think about this thing, egg, that is also artificially developed by giving hormone injections only. So within 40 days they will get the egg and all those things. So both the things, egg and milk, if we think that we have to give milk and egg to the kids, so that they will get calcium and they will help for growth and development. But after giving all those things, nowadays I think menstruation is happening for kids at the age of 9 years, and at the age of play, they can't play also because of this hormonal changes. Also, it may lead to, I think nowadays breast cancer is increasing only because of this hormonal imbalance. So late menopause, nowadays I think we can't consider this one, because after 40 or 35 years also now menopause is happening. I think we can find only very few people after 50 also this menopause occurs at the age of 50 or 55. And hereditary, I told, no, hereditary plays a very important role. It plays, but we can reduce that intensity. Just we can consider it as a 25%, and 75% lies in our hand. So exposure to carcinogens. Sometimes what happens, for example, we can consider that Punjab, it's a state where we can see that there is a train for traveling of the cancer patient, to take the cancer patient to the hospital actually, because there is only, they use more chemicals to grow the wheat. They spray so much chemicals that the spray itself causing the cancer to them actually. So chemical free food should be used. Always we should use organic products, or it should be chemical free, or we always should be very close to the nature. So always we should use nature friendly and nutritious food. So here you can see that it is a different types of carcinoma. It is serous carcinoma with nipple retraction. Here you can see nipple is retracted inside. So medullary carcinoma, it is common, it affects in the middle age. Inflammatory carcinoma, here it will be inflammatory changes. And when I explain that in inflammatory changes, if it is benign, then I will suggest to use Dashangalepa. But if it is a malignant tumor, when it is confirmed like breast cancer, I never use any local application. Always it is better to give medicines internally and treat the disease. Because sometimes what happens, I think one of the few patients I treated, what happens when cancer is diagnosed, all the person starts giving them the suggestions. Oh, you use cow's urine, it has given good results, so start drinking that. And some people will say you drink lemon juice, it will treat the cancer. And some people will say you use cinnamon bark. So they will start trying all the things told by some of the relatives. Few patients did the same thing. She was having inflammatory changes, and the pitta was predominant. She is a pittaja prakriti, and she started drinking the gomutra early morning, empty stomach. I think she did it for only 4 or 5 days. This the breast ruptured and the vrana was formed over that. She came to us with that vrana and severe pain and secretions, and I treated that patient. First vrana chikitsa was done to heal that one. Then afterwards I gave Shiva Gutika and MAC 4 and 5 and treated the case. So here you can see that inflammatory carcinoma. See, when there is an inflammation, we should be very careful. It may suppurate and it may go to the different structures nearby. Even it can damage the pectoralis minor muscles. So here stages of breast cancer. So stage 0, we can consider that is most favorable stage if we diagnose it in early stages. And stage 1, it will be only an inch in diameter. So we can easily treat it. Or if possible, we can also go for lumpectomy. We can remove only the lump and we can treat it easily. If it is next goes to the further stage, stage 2, what happens? The size will be spreading to the lymph nodes in the armpit. Okay, axillary lymph nodes. When it enters the axillary lymph nodes, see, when the cancer reaches the lymph nodes are the main culprits which transport these cancer cells to anywhere in the body. It can reach to the lungs, it can reach to the ovaries, it can even reach to the bones, brain, everywhere it can go, and it can spread the cancer soon actually. So it's always better to treat or identify it in the early stages, stage 0 and stage 1. So when it spreads to the lymph nodes, it will be we have to undergo MRM. Then we have to, depending on the, if it has not affected other structures, we can treat with Ayurvedic medicines. So stage 3 is if the breast cancer is in large size, more than 2 inches in diameter. At this stage, I remember one patient. She was only 32 years. She was having 3 inches in diameter. The breast cancer, it was very huge actually. It was 3 inches in diameter. And then she came to my clinic saying that already screening was done. She screened about the cancer in the Shankara Hospital and also in Kidbai. She had the family history of the cancer, that even her mother died because of the breast cancer, her aunt also died because of the breast cancer, and her cousin also had the breast cancer, and she did this surgery and chemo. And she was in the intention that she was not willing to go for the surgery and chemotherapy. So she came to me saying that give me some medications and treat this. She was only 32. Then I spoke with her and I counseled her. I gave the counseling saying that, see, you have the fear already. You have seen that family history is more, and even this ER and PR is also negative. Positive, it was positive. So I told her that it's always better to go for surgery, and after that you have to go for chemotherapy. Then I told her to go to Shankara Kidbai, get it done. But after a few days, what happened? After 2 months, she called me saying that she is having a pain in the breast, and she wanted treatment for that. Give any medicine so that the pain will reduce. Then I asked, I told you to go to get surgery done. No, why you didn't go? She told that she consulted some this Nati Vaidyas. He told that he gave some Lakshmi Taru medicine, and he told that if you take these medicines for 3 months, 4 months, so it will completely cure the cancer. And she was doing that one, and she didn't go for the surgery. Then I told her to come and meet me. Then next day she came. I told her, you have to get the surgery done. Afterwards, okay, no need for going to chemo. Yeah, we can treat with Ayurvedic medication. So after that, she did the this thing in Shankara, mastectomy. Then after that, she came to me and I started medicines without chemotherapy. I gave the medicines and she was now managing well actually. So 4th stage, metastatic breast cancer. It is a tumor size will be more, and even it may spreads to the bone, lungs, liver, brain. When it reaches to the bones, lungs, liver, brain, then it will be very difficult. So in this stage, we can't do any surgery, but here we can go for systemic management. That is, we can use a chemotherapy, or if ER and PR is positive, then we can go for hormone therapies. Here you can see the stages of breast cancer. If it is in the 0 stage, we can give 100% survival rate is there, and 1%, 98% also first stage also we can cure it, and 88% that is second stage also we can cure. Even in third stage, we can cure that one with 52%, 50-50 chances are there, and in fourth stage, metastatic stage, so it will be very difficult. So in my clinic, I handle the cases, making it into 3 groups. It will be always fresh group, like it will be in the 0, 1 or 2 stage. It will be diagnosed freshly by in my clinic, and then I will start medications. And another group will be after surgery. They are not willing to go for chemotherapy and radiation therapy. Then we will, after surgery, we start the medications to avoid the chemo and everything. And another third stage, and in that fourth stage, what we can, because it is a metastatic stage, it has spread all over the other tissues in the body. So what I will do is, usually I will suggest them to go for chemotherapy. With the chemotherapy, I will start Ayurvedic medications, so Rasayana Chikitsa, and if the bala is more in the patient, then I will also do Shodhana. After Shodhana, I will start Rasayana Chikitsa, and it is giving very good results. So when metastasis happens, what happens? The patient starts losing the weight, and there will be a fatigue, tiredness, and lack of appetite. We can see. And sometimes even what happens, they got treatment for the breast cancer or ovarian cancer or endometrial cancer. Afterwards, it may recur, and usually they will come to know at the stage of metastasis. And it may also affect the lungs, liver, and nearby structures actually. So I told BRCA1 and BRCA2. Now it is it is a simple blood test. By doing this one, you will come to know that there will be a change in the 17th chromosome located. So in BRCA2, you can see that chromosome 13 will be changed. Just by doing this simple blood test, we will come to know about the chances of hereditary cancer and genetic this thing, and family hereditary cancer. So by that, if 80% chances of developing breast cancer, so we can get it treated early itself. So HER2/neu is a protein, is a growth stimulating protein, which is present in the normal cells. You can see here it is very present in very less quantity, but in HER2 plus cells, what happens? It will be more. Actually, it will be increasing. It will be giving command from cell to the outside, and it makes the cells to grow faster. So more abundant will cancer cells becomes more in the breast. So in these cases, we can we should do meditation, yoga, and pranayama is very essential. See, cancer cells will grow in the absence of oxygen. So in the absence of oxygen, this cancer cells will grow more. But if oxygen supply will increase to the cell, what happens? This cells will die actually. Because of that, we have to do pranayama and meditation, and also try to solve the hormonal imbalance and take the nutritional food and follow the good lifestyle. So HER2/neu protein, when we do the test, no reactivity is seen. We can see it as a negative. And when we see there is a more reaction is there, more than 30% positive. So breast cancer prognosis is very good. Survival rate is also very good. So we have to identify the breast cancer early. So we have to make the patient to keep the hands by the side, and we have to examine the nipple for any bloody discharge, centrally retracted nipple. So presence of pedo orange indicates the tumor infiltrating to the areola, and skin over the breast, and you have to find for the lump. So whenever you find difficulty in finding the lump, then you can do simple tests. Whenever the patient comes saying that they have a doubt or they have the pain in the breast region, you can suggest only the ultrasound scan of the breast. So when you find anything changes in the ultrasound scan, lump or anything you suspect, then you can go for mammography. So edema of the arm is due to the lymphatic blockage. Sometimes we can see that there will be a edema or swelling in the armpit or the axil, in the upper limb, the right. If there is a limp in the right side, right breast, you will see the changes or some sort of pain, tingling pain will be there in the right hand. Or if there is a lump in the breast, or if it is suppurating, if it is spreading, you will have the pain in the this left this thing also. And we can see that many cancer will not have pain, but usually ductal carcinoma, when it is spreading to the different structures, nearby structures like muscles, it will cause severe tingling type of pain. Usually the patient complains the same thing. So always early diagnosis we have to do. Then when it has spread to the different structures, you make the patient to bend forward. So the breast will not fall forward or fall forward because of because it has spread to the different structures, pectoralis, minor muscles, and other structures near this thing. So axillary lymph nodes, the breast will not fall. So palpation, we can see that local rise of temperature and tenderness is there, and describe and we can see the lump, and irregular soft tissues will be present, and intrinsic mobility, and plain we can see that swelling will be there, and pectoralis major contraction test and serratus anterior contraction test can be done. So diagnosis, we can do the CBC and mammography, FNAC, and so biopsy we can do. So ultrasound guided biopsy, chest and ultrasonography of the abdomen. See, whenever a patient comes to us saying that, when we confirm it, like to confirm it has a cancer, I always go for biopsy. After biopsy, if it confirms like a cancer, staging is essential, whether it's in the stage 1, stage 2, or it has metastatic. So to do that, we should always go for the PET scan. So whenever a patient comes here in Ayurvedic this thing treatment, in my clinic, they say that PET scanning is needed only to do like radiation and chemotherapy and all. But I don't think so. We have also should know whether it is metastatic, it has spread to other structures. After knowing that, only we can plan the treatment. So here, if it is in the 0, 1, and 2 stages, we can plan surgery. 0 stage, we can plan surgery, and 3rd stage, surgery, radiation, and chemotherapy. If it is in the 4th stage, we should go for chemotherapy. So after surgery, chemotherapy in the 4th stage. And if ER and PR is positive, hormonal therapy. Tamoxifen is the most commonly prescribed hormone treatment, and nowadays immunotherapy is also becoming very popular, and now ozone therapy and dietitians and diet for cancer is also becoming very popular. HER2/neu, now we have a HER2/neu protein vaccination, so which can be given monthly shots for 6 months. It does not have any side effects, but it is also giving a good response. So for HER2/neu, we have a trastuzumab. It is a biological therapy where we use this monoclonal antibody therapy. So by this, we can cure this HER2/neu negative breast cancer. So surgery, I told if it is diagnosed in the early stage, in the 0 stage, we can do lumpectomy. Only we can remove the tissue. Surrounding areas, area will be normal tissue. So that sort of cases we can handle very easily. If it is in the second and third stage, simple mastectomy, and their entire breast and other structures will not be affected. Modified radical mastectomy, MRM, is done if it is spread to the axillary lymph nodes. So whole breast and axillary lymph nodes and also axillary tail will be removed. And radical mastectomy, nowadays it's not popular actually. So patty mastectomy or MRM. Now what we are doing, that is MRM. Patty mastectomy, it is most acceptable worldwide because most of the surgeons, they say that whenever we remove that lumpectomy, partial simple lumpectomy, it is not such a good treatment. They say that always we should go for MRM, because whenever if the axillary lymph nodes are enlarged, means always we should remove it, so that there will not be have the chances of recurrence. So I can remember one case that one of my, I think a senior, she had given birth to 2 kids. After 1 year after the birth of the second child, she was able to she was identified as a breast cancer. Then she searched for the best surgeon in this in India. From Bombay, she called them and she did the surgery. She told them the mastectomy was done, mastectomy was done, MRM was done, but the bad luck was that he left only one axillary lymph node. It was only inflamed. It was not a benign, it was not malignant, saying that it will come down by chemotherapy. After chemotherapy also, it didn't reduce. For her bad luck, what happened after, I think 3 years, she had an ovarian cancer. So it's always better to do MRM. So level 1, it extends from axillary tail and it extends to the pectoralis minor in level 2 and to the apex of the axilla. So here we can see the lumpectomy incision. So modified radical mastectomy. So this, you can see the complications of MRM. Here you can see that the lymphoedema in the right limb. When such cases, usually I handle such cases when after MRM, they will come to us saying that there is a pain and swelling in the limb. Then I start giving them Nityananda Rasa, Chandraprabhavati and Varunadi Kashaya. It is giving very good results, and I will tell them to take Shigru in the food regularly. Here you can see that the lymphoedema. What happens after mastectomy and everything? So breast reconstruction is also needed. Sometimes what happens, because of the loss of the breast, they will have psychological stress and mood disturbances and increased consciousness about the clothes while wearing the clothes and other things. So negative image will be increasing. So to build the confidence, so we have to reconstruct the breast. So metastatic breast cancer can be cured in 2 ways. One is when ER and PR is positive, we can do the hormonal treatment. The response is good. And when ER, PR is negative, we can do the chemotherapy. Good response is present. And when R2 we can go for trastuzumab therapy. So here we can make, like in Ayurvedic, when metastatic breast cancer is there, we can do the Shodhana and Shamana Aushadha. So when the bala of the patient is more, we can do the Sroto Shodhana, that is Vamana or Virechana, depending of the dosha involved. And so we can solve this hormone imbalance, and then we start some Rasayana therapies, and also Shivagutika and Kanchanara Gugulu can be given. Here I usually use Brahma Rasayana and Rasayanas depending on the symptoms what they exhibit. And ER and PR is negative, means there I start giving the Paniya Kshara, because it should act like a chemotherapy only. It should be very strong. So I give Paniya Kshara. See what happens after surgery, after treatment. Sometimes the handling the comorbidities will become very difficult. So when systemic, when it is metastatic, we should always go for hormonal therapy or chemotherapy. When it is in the 0 stage or first stage, we can do the radiotherapy or mastectomy. So I told that in fresh cases, what I will do is I will start Srotoshodhana. After Srotoshodhana, I will start the medications like Paniyakshara. Paniyakshara, depending on the nature of the patient and also the nature of the disease. So I will start Paniyaksharas. I usually use this Apamargakshara or Evakshara or Palashakshara, depending on the Vata, Pitta and Kapha predominance, I will use that one. So here, adjuvant hormonal therapy, that is tamoxifen, usually it will be given for 5 years, and chemotherapy. So we should always see that we say that we always give with chemotherapy Ayurvedic medications and it's giving good result. But we should know that what is the symptoms they are having and which medications they are taking, and we should handle that in such a way that they should not have the side effects. So adjuvant chemotherapy usually is cyclophosphamide and adriamycin and fluorouracil, this thing. So usually it will be given 21 days and 6 cycles. So here we can see that cyclophosphamide, it will have a side effects on the renal toxicity will be there. So when there is a renal toxicity is there, usually I will go for this Gokshura. Gokshura is also a rasayana and it will give very good results over the removing the toxins from the renal. So Gokshura I will prefer usually, and also Chandraprabhavati. And when there is hematological toxicity is there, anemia and thrombocytopenia, in that such cases I will use usually this Kaishora Gugulu, and sometimes even simple this Kamaduga Rasa can give good results, and Punarnava Mandura in anemia, it gives very good results in chemotherapy patients. And GI toxicity is there, that nausea, vomiting. So in such cases, when there is a nausea and vomiting, simple we can start using the Madhifala Rasayana. It gives so wonderful results that the vomiting will also be stopped and they will get a good strength. And when there is a diarrhea, I usually use Pravala, the compounds having Pravala like Pravala Panchamrita, or you can use Kamaduga with Mukta also. So when there is a skin toxicity, that is alopecia, hair loss and hyperpigmentation, etc. When there is a hair loss, alopecia, you can start giving Narasimha Rasayana. So it will give very good results. So when there is cardiac toxicity, so when there's cardiac toxicity, I usually tell them to take garlic more, and usually in the form of Kshirapaka. So Lashuna Kshirapaka I usually suggest them. If the bala is more and they are not having any this pitta predominance, then I will suggest them to use Lashuna Kshirapaka. Even that Lashuna or Allium sativum is having a very good result in curing or preventing the cancer in the breast and lungs. So pulmonary toxicity, high dose therapy. So when there is related to the pulmonary this thing or lungs, is you can use a simple this Sitopaladi Churna combined with some of the Aprakabasma or the related, depending on the symptoms, we can add the basmas which will going to cure that symptoms. Hepatotoxicity, then in that I think I usually use Kirata Tikta and Bhumi Amalaki. So Bhumi Amalaki is giving wonderful results in this hepatotoxicity. And usually when I will start this treatment for chemotherapy patients, I will start giving the Bhumi Amalaki from the beginning until they will complete this chemotherapy treatment. When there is a nasal congestion, just you can use Anutaila or Kshirabala 101 to put the drops. It will give you good results. So same things even with the adriamycin and fluorouracil also. when a patient is diagnosed as a cancer, always we should give the counseling to them. Even when a patient comes to my clinic, I always do the counseling for them. After 2 counselings only, I will take the patient for the treatment, because they will have the confusion. They will be in the confusion state. They will have the confusion that whether to go for this chemo, radiation, or Ayurvedic treatment, or they want to go do the different sorts of diet and all those things. But what happens in this confusion stage, we should not start the medicines. Always we should tell them to do all the routine investigations what are needed. Then after the PET scan and biopsy only, we have to take up the case and then plan the treatment after taking the consent. So in the breast cancer, always it is but early diagnosis is the best thing, and BRCA and ER negative, and BC and BRCA tends to ER positive, and getting first child before 30 years of age, and breastfeeding, and all the mothers and women should breastfeed the kids. That will act as a shield to the breast cancer. And self-screening by best preventive method. Self-screening, always everyone should do the self-screening. So early diagnosis, or we can prevent the cancer. So always prevention is better than cure. So we have to prevent the cancer. So here you can see that this is the Paget's disease, or it is the disease, Paget's disease of the nipple. It's also called as Paget's disease of the breast. It is affecting the unilateral side, and it is, you can see the redness or erythromatous. This patient usually used to come from Shivaji Nagar. One complaint was with her is after application of some medicines, it used to reduce that oozing and redness. But after few days, once again, it used to start this oozing. So I gave her the MAC 4 and 5 and some Lepas, that is Panchaguna Taila application. It gave very good results with this patient, and also started Shiva Gutika. Here is the breast cancer case. It is a female patient aged about 54 years. She was complaining of a lump in both the breast since 6 months. So here you can see that it is 18/10/2023. That is 10th month, October month. This is this thing. And here you can see that it is after 4 months. In January 31st, we could find the difference in the ultrasonography, that is mammography. So sonomammography, here you can see that in right breast, it is 11 to 12 o'clock position, 28 into 22, 27 mm lump was present. But it was reduced in 31st. It was reduced to 13, 21, and 25 mm. And here you can see 9 o'clock, 10 into 6, it reduced to 4 into 5 mm. And right axillary nodes, 16 into 24 mm. It also reduced. So here you can see that there is a drastic reduction in the lump size. And here we can see that the left breast at 5 o'clock, it was 11 into 14 mm. It reduced to 4 into 10 mm. The result was very good. So impressions, here you can see it was a BIRAD 6. It was BIRAD 6 only, but here you can see that bilaterally breast lesions and right axillary nodes appeared reducing. When we compare both the things, it is reducing lesion, and axillary lymph nodes are becoming reduced and becoming healthy. This case, I started giving her Paniyakshara, that is Yavakshara. I started giving her Yavakshara and Shiva Gutika, and this Cruel, Kanchanarapugulu, and the Varunadi Kashaya, and it is giving very good results. And I have one preparation called Arbudahara, which I prepared 18 years back. I first prepared that preparation because 18 years back there was no medicines were available for the cancer patients. That time I referred many Rasa Tantra books from Rasa Tantra Sara and Siddha Prayoga Sangraha. I found that preparation and I prepared that and I gave to my patients. It started giving very good results. So metastatic breast cancer, depending on which structure it affects, you can see the different symptoms. So treatment of the breast cancer, we can divide into these three columns, like Shodhana, that is Sroto Shodhana, Vamana or Virechana can be planned, Shamana and Rasayana therapy. So Shamana therapy, I use usually Kshara, I told, and some Lekana Dravyas and Chedana Dravyas, and you use Shiva Gutika and Shigru Churna. Shigru Churna I prefer in these breast cancer patients. It gives wonderful results, and I never use that curcumin. What many people say that the curcumin gives very good results in the cancer, but I tried in many cancers, but it doesn't work. I usually tell them to use the this Haridra, which is natural, daily in their food and are consumed with the hot water, like that only. I never use that the alkaloids actually. So here in Rasayanas, I told, depending on the conditions, in chemo patients, I will use this Rasayana. If they are there is a loss of memory or any disturbance, headache and other things, I will use Brahma Rasayana. And if there is a loss of sleep, I usually suggest them to take Ashwagandha Paka. And if there's having hair fall and other things, I will tell them, if Pitta is predominant, Narasimha Rasayana. And if there is a weight loss, I will suggest them to start Amrita Prashagrita. See, when there is a chemotherapy, the patients start losing the weight. And if they want to continue the therapy, the weight should be maintained. So always I prefer in these patients to give the ghee, medicines in the form of ghee. What happens in chemotherapy, all our other cells, normal and even the these cancer cells will be burnt. They will be, Pitta will be predominant, and the patients will be having very severe dehydration. And sometimes what happens after first session of the chemo, next day usually the patient fall unconscious. The patient attendant will call you saying that they are unconscious, whether we should go to the oncologist. Then I usually tell them to start this Madhifala Rasayana and Kamaduga Ras, and I will tell them to use the diet which is bland diet. Always it should be Pitta Shamaka, like take pomegranate and this juices, coconut water, everything. So MAC 4 and MAC 5, depending on the other conditions, whether if it is present in affecting the nearby structures or bones and anything, I usually suggest MAC 4 and MAC 5. So to prevent the breast cancer, always we should control our women always should try to control the weight by doing the little bit activities. Like everyone, when a woman patient comes, we say you do some yoga or walking. They will say that in home only we will be doing our work. We will be cleaning everything. That is like activity to us. But always we should do pranayama and meditation. It will help to relax the stress and also help to reduce the hormone imbalance. And to reduce the hormone imbalance, there is this thing. Always we should rise early. Always we should get up early in the morning, at least at 5 o'clock or before sunrise, and early to the bed. We should go to bed by 10:30, and then we should always have dinner by 8 p.m. See, this is all, whether it is a cancer in any part of the body or breast cancer, it is all lifestyle disorders. Always we should change our lifestyle and help, and by changing the lifestyle, we can prevent the disease. So always we should take ahara, we should maintain good ahara vihara pattern. So we should avoid alcohol and limit hormone therapy and abhyanga. I will say that we should do abhyanga. Nitya Abhyanga should be done. So all of you are doctors, so you know that by doing Nitya Abhyanga, we can maintain the activities of the cell normal, and it will not grow abnormally, and it will help our body to be slim, and also it will help us to maintain the health. And I told in the beginning, no. So if the breast starts becoming hard, when you start palpating, you feel that, oh, it is that could you can see in before this menstrual cycles, you can see that breast becomes very hard. After menstrual cycles, it will become soft actually. So whenever you feel that the breast is becoming hard, or when any patient comes saying that they have a pain in the breast, or breast is becoming hard, you can suggest them to do the massage or abhyanga, or local massage also is useful with the Kshirabala Taila or any aloe vera gel. It will help you to prevent from breast cancer. And also another thing is you should be sexually active so that even the breast cancer can be prevented. So ovarian cancer, this breast cancer, next one is ovarian cancer. This is like they have interconnections. So if breast cancer is after treatment of breast cancer, after few years, you may get this ovarian cancer. So whenever the patient of breast cancer is there, we tell them to do the blood test for CA-125, so 3 months or 6 months once, so that they will be able to identify whether they are having ovarian cancer or not. So it is a simple blood test. By that you will be able to differentiate. Here you can see that this is the tumor or cancerous ovary. Nowadays, I think because of hormone imbalance and I can say that this PCOS problem is increasing because of the diet, what we are taking, that is the North Indian or Chinese food or Ajinomoto, what they are using for taste makers, and this junk foods and packeted food, sealed foods, everything were causing this hormone imbalance and leading to the cancer. And I always like to say that 5 white should be always avoided. One is the white rice, white salt, white sugar, and maida. And another, the white one is the egg. Always you should avoid that one so that you can be healthy. So symptoms in ovarian cancer is, here you can see that abdominal bloating, unexpected vaginal bleeding, weight loss will be there. Okay, so starting with weight loss will be there, nausea, fatigue, tiredness will be there, and sometimes constipation and other constipation, frequent urination will be there. So unexpected vaginal bleeding will be there. So we can treat this ovarian cancers by giving the Gulma Kutara Ras, so Shiva Gutika, and Cruel Plus capsules. So depending on the symptoms, what they exhibit, depending on that, we can give the treatment. So diagnosis, we can do it by by physical examination and history taking, and then we can, I told CA-125 will help us to know about the ovarian cancer, and HCG levels also, and also we should check for estrogen and testosterone levels. And if needed, then we can go for CT scan. See what happens, many patients come to me saying that some people, they will not do this FNAC or biopsy. They will go for surgery without doing this. If there is any growth in the ovaries or abdomen, that is not the correct thing actually. Always we should, any growth in the body, anywhere in the body or any growth in the body, always you should go for FNAC and biopsy, and you should confirm whether it is a malignant tumor or benign tumor. If it is a benign tumor, after surgery nothing will happen. If it is a malignant tumor, what happens, that will lead to the metastasis. If it is known that it is a malignant tumor, before doing surgery, you should go for 2 sessions of chemotherapy, then on you go for the this surgery. So CS cervix. CS cervix is also the most common disease which occurs most commonly in women. I think most of the women are suffering from CS cervix, and nowadays there is a trend of taking this vaccination, HPV vaccination. And so they are telling that at the age of 13 years and 15 years, these girls should take this HPV vaccination. But when I spoke with the many gynecologists, they say that they don't know the effect of the HPV vaccination prevention. But there is a statement in HPV vaccination saying that if you are sexually active, this HPV vaccination will not help you preventing from CS cervix. Okay, but they are suggesting the vaccination at the age of 13 and 14 years. When we take the cause for CS cervix, it is when they are sexually active, they will get the CS cervix. So taking the vaccination is not going to help. So here you can see that cervical cancer. This is the normal cervix. So early stage, starting, you can see here, there will be small growth like, then if it is not treated, then it will lead to the larger lump, then it spreads to the nearby structures, and bleeding in the vagina will be there. So when in cervical cancer, when there is a bleeding in the vagina, so you can use Chandrakalaras and some of the medicines, Stiflon, it will give very good results and it will stop the bleeding. And in such cases, usually I will start even MAC4 and MAC5, that gives them very good strength. Cervical cancer, the vaginal bleeding and pelvic pain will be there. And vaginal bleeding, if vaginal bleeding will be there after menopause, some people will, the menopause will be occurred, and after 6 months or after 1 year, there will be a white discharge from the vagina, or sometimes also the bleeding will be there. They will think that once again this menstrual cycle has started, but it's not like that. Always we should do the pap smear test and other tests to rule out this, and then we should treat it properly. So CS cervix, we can find it just by bleeding on touch. By touch, it will start bleeding. So by that, we can able to identify it, and diagnosis will be confirmed by histopathological examination by biopsy sample. So cervical cancer, yeah. So cone biopsy, depending on the different stages, we can opt the cone biopsy and CT, MRI, cytoscopy, everything can be. So prevention of carcinoma cervix. So usually what happens, early marriages should not be done. We have to avoid the early marriages, and we should educate the people and avoid early intercourse also, and proper hygiene maintenance should be taught to all the women, and use of barrier contraception should be told. And screening program should be done for pre-malignant lesions, and screening for early diagnosis, because of CS cervix also, the death rate is increasing in rural area. If it is diagnosed in the early stages, we can treat it very easily. So differential diagnosis, we always should differentiate with the fibroid polyp, chronic inversion of the uterus, and cervical tuberculosis, and cervical ectopic pregnancy. So treatment for cervical cancer. So depending on the stage, we can treat that one using this chemo and that is surgery, radiotherapy, and sometimes needed combined therapy can be done, like chemo and radiation both. I think so. This Sonia Gandhi is a survival of CS cervix, and we can see that most of the Hollywood and film actors like this Sonali Bendre, Mahima Chowdhury, and Manisha Koirala, everyone are survival of this breast cancer, and it was diagnosed in the metastatic stage, and they could recover from it. And whenever they speak about the breast cancer, they say that by following the yoga and Ayurvedic and with the last change in the lifestyle, they could able to come out of these problems. And One thing is when a carcinoma of cervix or CA ovary will occur. No, what happens in CA ovary if it is occurs in youngsters, if they have not given birth to a kids, ovarian function can be maintained. So when they undergo the chemotherapy, what happens? Ovarian functions will be varied and there will not be release of the ovum. So nowadays they will store this ovum, the egg, and they will do the chemotherapy afterwards, and after the chemotherapy they can do the IVF and they can give birth to the kid, and preservation of vaginal function also done, and complications are also corrected. The complications here is hemorrhage, infection, and uterine injury. So Ayurvedic, in cervical cancer, we can treat by giving, we can treat it like gulma, and here we have a local treatment. We can do Yoni Varti Dharana, which is prepared with Pipalyadi Varti and Nimbadi Varti. I usually do that, and Saindavadi Taila. So Yoni Pichu Dharana Karma, I will give the patient some of the medicated ghees and Dashamula Taila, so that they can do the Yoni Pichu Dharana. And Yoni Purana Karma, I will do it in the clinic by Panchavalkala, this thing, or Falagruta paste. I use that one. And then Yoni Prakshalana using the Negrodadi Kashaya and Maharasnadi Kashaya. So in cervical this thing cancer, depending on this thing tiredness and what are the symptoms present, we can use medicines like I usually give Gulma Kuttararas and Shiva Gutika and this Pravala Basma and Manasa Mitrati. See, I told hormonal imbalance will be there. So to control that one, I usually give Manasa Mitravati with gold and Matiphala Rasayana I will usually give to these cases. And Smriti Sagara Rasa also I will use. So Patya and Apatya. So when we come to the Patya and Apatya part, according to Yoga Ratnakara, we can use Purana Dhruta, and I told we should be always close to the nature. We should use the natural things. Like nowadays, I think we are back to the olden days. Now everyone started using the mud parts. We should not use this non-stick pans actually and Teflon coated pans. When there is a small damage to that one, the food reacts with the Teflon coating or this non-stick pans, and it will cause cancer. So always it's good to use the mud pots or steel vessels or the older this thing. We have to follow the older patterns only, and we have to use the naturally grown food, and we should use the Shastika Shali for eating. See, by eating Shastika Shali, what happens, that Rajamudi or Shastika Shali, what happens, it will give satisfaction by eating the little bit quantity of rice also, and it will give has satisfaction and also the strength to the our body and bala to the body. And what we are now using polished rice, it will not give any strength to the body, and instead it will cause damage to our tissues and cells, and it may lead to the cancer also. So, and always we should have the habit of storing the these grains. Nowadays we don't store the grains. We usually order it and we buy it online and we use it immediately. Always it's better to use rice, ragi, and wheat and all 1 year old. This will give you good strength actually. And the freshly grown rice and all will have more sugar. This sugar will increase the growth or give strength to the cancer cells, and cancer cells will grow more by this sugar. So always we should cut sugar and glucose so that the cancer cells will regress easily. And yava, mudga and other things we can use it. Always I will suggest to my patient that Yusha preparations and some of the yavagus while giving the treatment, because always light food will help in the digestion and also stimulate the because in all the diseases Agni also should be maintained, so it will help to cure the disease easily. and I prefer using the Shilajitu. So in when there is a renal symptoms in this chemotherapy, I usually use Shilajitu also. It gives very wonderful results. And Apatya is always, you should tell them to avoid sugar, cane sugar and milk products. In milk products, you can use butter and buttermilk and ghee. You can use it sufficiently. And mamsa and amla rasa you should avoid, and especially tomato should be avoided because its origin is in South America and we are using it plentifully in India. Always we should use tamarind and kokum to avoid the cancer. So here the CA rectum and CA colon. I told in women CA rectum and CA colon is also most commonly seen. To the Raktarbuda. So in Raktarbuda, while explaining Sushruta, it says that there will be a mamsa growth will be there, and from that there will be a bleeding will be there. So because of that, excessive bleeding will be there in CA rectum. One patient came to me in my clinic saying that she is having rectal bleeding and small lump in the rectum. When I examined the case, she was only 50 years. She came with her husband. When I examined, I could find that the irregular growth in this rectum, and it was a CA rectum. Then we told them to do the biopsy and also the colonoscopy. And we treated the patient with Ayurvedic medications, and they took treatment for 3 years, and she got cured with this CA rectum. CA rectum we can cure with Ayurvedic medications, and it will give you very good results. And we can manage it very well if it is in metastatic stage also. This CA rectum, this is the first case I treated 18 years back. She was from Kidwai. CA rectum, it was a metastatic stage, and the HB was very less, and muscles were also not there. She was brought and kept over the table. She was not having the consciousness also. Then I spoke with the attender saying that I can only improve the quality of life. If you are okay with that, I will start the medications. Then they told okay, because in Kidwai they told that she will survive only for 2 months. Then after I started medications, I think after 15 days she was able to walk, and she came to my clinic. Then every month she used to come. I gave some balataka preparations, and I started giving this Kamagaga with Mukta. And when to stop the bleeding, I started using this Chandrakalaras and some of the other medicines depending on the situation. Then I think I made her to live for 2.5 years without going to any of the hospitalization. Just she came to my Ayurvedic clinic, and she used to consult monthly once. She used to say that when I will come and meet you, I will get a good energy, and she used to do all routine works in the home. So after doing all the protocol or all the modality of treatments, like after surgery, after chemo, after radiation and everything, sometimes what happens, it will give good results and it will not recur. I have seen case like after doing mastectomy 18 years back, then now after doing all the modality of treatment, every year she comes to me, and she is taking for prevention. And since 18 years the recurrence is not there. But in many cases we see that after following these modalities, they think that, oh, nothing is there, we are happy. Then after few years, 3 years, or after 2 years, or after 6 months also, recurrence will be there. That we can be considered as Adyar Buddha or Dvirar Buddha, and usually it affects the lungs or the ovary. If it is diagnosed in the early stage, we can cure that one. If it is in the metastatic stage, it will be very difficult. So always in this granthi or arbuda or whatever in cancer, rakshet balam chapi narasya nityam, tad rakshitam vyadhi balam nihanti. So always we should store the strength of the nara, so human being, so that the bala of the person should be increased, so that he can be able to withstand the disease and also get cure of it and also withstand the treatment. So thank you.
Thank you, ma'am. It was wonderful presentation. What I have remembered by listening your presentation is, in school days we used to get one guide. Okay, it was so simplified one, and stepwise they might have been given in that guide. It was very easy to read and understand. In the same way, your presentation was there. It was so easy and stepwise you explained very well, ma'am. Thank you once again. And shall I take the questionnaires?
Yeah.
If anyone has any queries, you can raise your hand and unmute and you can ask directly, or else you can drop a message in the chat box.
Indeed, ma'am, it is a very nice session actually. And as Dr. Geeta told, it is a very understandable, easily. So step by step, we have made it to understand briefly all the related cases, cancer related to women. It is very well you have elaborated. Thank you so much for taking this time. And I think many of the questions are in chat box. Dr.
Yes, ma'am.
Geeta, you can go through it.
Yes, ma'am.
Ma'am, if patients who have not breastfed only, no secretion, even after first and second delivery, so chances of CA breast.
Hello.
For this one, patients who have already given birth, ma'am, there is no breast secretion.
No, it's always we can't make or we can't claim like that, because nowadays I have seen many cases after giving birth to two kids and giving breastfeeding for 2 years, 2.5 years, they will feed only to get not for should not get the cancer like that. But in spite of that, also they will get the cancer. It's because of we can consider it like Raaauos Drushti, Chintya Namcha Chintanam.
Okay, ma'am. No, as even after delivery, when they have not this one breastfed only, ma'am, lactated only, there won't be growth of the breast also. No, so much
Huh?
as earlier. So, in such cases, there are chances of more breast cancers over like.
No, I was not able to understand.
And I mean to say, ma'am, after first and the second delivery, the lady has not lactated or breastfed only because of there is no milk secretion. She has completely stopped as the baby is completely on this one, ma'am.
But that is some pathological condition. No, it will not cause any problem. But if you are having a good secretion of milk, in spite of that, if you are not feeding, then it will lead to the problem. That I told you, even in miscarriages, sometimes what happens, fourth month or fifth month, we could see that after few days, there will be a secretions from the breast for that
Yes,
ladies usually. So breast
yes,
changes will be happen prior only. So that
yes, ma'am.
changes, if it has happened, that will lead to the formation of the lump or growth of the uterus.
Okay. Thank you, ma'am.
Ma'am, Dr. Pushkala ma'am is asking, please share your experience in triple negative cancer of breast.
Okay, so triple negative cancer, I usually use the same modalities. First, if the bala is present, I will do the sroto shodhana, that is vamana or virekshana, because we have to cleanse the srotas. As I told, rasava srota drishti I will consider here and I will treat the patient. Then I will give this paniya kshara. Usually, I will take apamarga paniya kshara, but because it is triple negative triple negative. So there I will always prefer to give the kshara with gruta. So like Shatfala gruta or some Tikta Dravya gruta, I will start this kshara. And also internally I will start giving this Leha, MAC 4 and MAC 5 and Shiva Kutika. And I told one of the preparation is Ambudahara preparation I have. So that also gives very good results.
Okay, ma'am. Thank you. Dr. Mamta is asking, please explain about dense breast and related cancers of chances of cancer.
Dense breast, actually what happens if some people will be to look they will be thin only, but their breast will be fatty. So in such cases I told we will miss while examining or self-examining also, will not be able to identify there is any changes in the this obese this thing of fatty breast. So in the such cases chances will be there. So because of that, if we have any pain or tingling sensation or any pain in the hands, right hand or left hand, so the such cases we have to do the ultrasound. Ultrasound of the breast.
Thank you, ma'am. Dr. Kala is asking, any special advice to overcome hormonal changes in breast during miscarriages to prevent CA?
During miscarriages, what happens now? After miscarriage, we think we will start doing our routine work. But during that time, we also should follow this, what we can say that Banantana or that regimen during that. At least for 15 or 1 month, they should do that one. They should use hot water and they can use that Bananti Lehya and Dashamula Arista, everything, so that it will modify the changes which has happened in the breast and make it normal. And also, if possible, before planning next conception, they should undergo this Virechana treatment so that the sources will be cleansed and they will not have the problem of fertility.
Thank you, ma'am. Dr. Madhumalati is asking, does the Lakshmana Phala helps?
Okay. Many of the breast cancer patients usually start taking this Lakshmana Phala, but depending on the case, we have to think, because Lakshmana Phala is increases the pitta. It is very hot in nature. I told no, if you are undergoing chemo and other things, if you start taking Lakshmana Phala, it will give you adverse effects only. But I have not seen any cases getting the results from the Lakshmana Phala, but it's everywhere it's like, oh, by Lakshmana Phala we can cure cancer, but I have not seen any such cases. Even that Lakshmi Taro also, and many single medications they will say even Inca Rosea can cure the cancer. But I think single medications we can't say like that. We have to use always the herbal preparations with some specific drugs. In breast cancer, I don't think it will give you very good result. And like that only, C rectum you can use bulk preparations. It gives good results. And in C tongue and oral cancers, Rohitaka will give good results. And in CA rectum, you can use wheatgrass juice. Some people will say we will take some vegetable soups, juices, and we cure the cancer like that. But wheatgrass will give good results in CA rectum. It will enhances the strength and also stops the bleeding for rectum.
Ma'am, could you please explain the tumor marker in breast cancer? Can you hear me? Hello?
Hello?
Can you hear me, ma'am?
Can you repeat the question?
Could you please explain the tumor marker in breast CA?
Tumor markers. We always should do the tumor marking so that we should be able to plan the treatment actually. So depending on the tumor marking only, we have to plan the treatment.
Next, in late menopause with normal menstrual cycle with hypothyroidism, what we can do according to Ayurveda?
Late? 1 minute.
Late menopause with the normal menstrual cycle
At
with
what
hypothyroidism.
Okay, hypothyroidism. So you should maintain this endocrine secretions. I told no, these three things you have to follow. That is dinacharya and rutucharya. Mainly early to rise, early to bed, and dinner at 8 o'clock p.m. And you should not watch TV and mobile. This is
During menopause,
this is a simple remedy actually. You can cut off from the hormone imbalance. So always I will suggest even for PCOD patient, PCOS and also to thyroid patients, you follow this ahara, vihara and vichara properly so that you will stop this hormone imbalance rising. Then we can treat it easily. And the simple thing, other thing is you can use this dates, dry dates too, and 10 kishmish and 10 kishmish. She can soak overnight and 5 badam, 2 dates and 10 kishmish. Soak overnight and early morning, empty stomach. She has to drink, make it like juice. Remove the seeds and make it juice, and she can drink in the empty stomach for 21 days. It will also help in stopping this hormonal imbalance.
okay, ma'am. Thank you. During menopause, if lady comes with any watery secretion during menstrual cycle from her breast, whether it is normal or abnormal.
Then it's abnormal only actually. Always we should do the ultrasound sonography. If nothing is there, it's good. If anything is there, you can diagnose it in the early stage. That's what I'm telling. No, early prognosis should be done always.
Ma'am, MAC 3, whatever you mentioned, is it your own preparation?
Mac 4 and Mac 5, it is the Amrut Kalash actually. Amrut Kalash what I am using. So it is giving good results actually.
Okay. Okay, MAC 1 and MAC 2, same question again. Can you share Arbudahara ingredients and how to fix dose?
Okay, but now at present I don't have. Later I will share with you actually.
Okay, ma'am. Thank you. Any more questions? Dr. Ratna? Dr. Annie?
Hello, ma'am. Good evening. Am I audible?
Yes, yes.
Okay, ma'am. It's a pleasure to listen to my.
Dr. Annie? Dr. Ratna?
No questions.
Okay. Yes, ma'am. You can answer.
Yeah,
Shakuntala ma'am.
same question as Pushkala madam asked, because triple negative CA, what I have seen 2-3 patients, which is very aggressive in nature. They got the disease and within 8 months, it will be of last stage of their this thing. And I think if they are not ready for Shodhana, what will be our alternate medicine, ma'am? If the patient is not ready for, if the bala is not that much, so how could we handle this and that?
I think always we should, when it is metastatic, no, we should go for chemo, depending on the condition. Then with that only you have to start the medicine. It will give at least immediate relief, because what happens, chemotherapy will burn these metastatic cells or cancer cells all over the body immediately. But what happens, our medications will be slow. So to improve this thing, quality of life, we can start our medications like rasayanas. I told Brahma Rasayana or Mac 4, Mac 5, you can start. So you can use that one. So we can maintain. See, After treating many cases, I find that if we will not touch we will not try to treat the cancer tumor or anything. The Rasayana therapies also we can maintain the patient for many years without any the symptoms actually.
And what about your experience of Gomutra, ma'am? Gomutra or Gomutra in breast cancer? Because many are using Gomutra. As you said, in inflammatory condition, we should not use. But in other condition, we can use. Is it okay?
Depending on if it is kapha predominant and meda is predominant, then you can use that one. That's what the yukti of the doctor should be there. You should decide. It's not the patient. They think that it is good. They should not take, because I have come across many cases. Simply they start using, if it is pittaja prakriti person and Vyadhi is pittaja pradhana, then it will cause damage to the tissue. Or otherwise,
And
kapha pradhana and mega pradhana, you can use it.
okay, ma'am.
And
Thank you
at
so
oral
much.
cancer, it gives very good results.
Okay, ma'am. So as you said, like if it is Arbuda, not to use any LAPAS, you told. Is it only on inflammatory condition or all the
Other conditions.
all
Till
the
now,
conditions?
I have not used any LEPA application. Only if it is abscess, we can do
Okay.
the LEPA.
Shodhana and Runaropana treatment, we can do
But
that one.
in this Arbuda condition, what happens if it may be metastatic or after application of LEPA, it may suppurate to the other structures. No?
Okay, ma'am. So any
What
Jalo
about
Kavacharana did in your this thing, ma'am, breast CA? Jaloka have you applied for this thing?
No. I have not applied anything to the.
Because you are from Shalya background, that's
Yeah,
what
I
I'm.
usually do the Jalokavacharana. I did it for many cases in CA rectum. CA
Oh,
rectum,
nice,
when
ma'am.
the mass was, we could feel it outside. I told now the first case in CA rectum. I started doing the Jalokavacharana. I did it for the patient. The mass was huge. It was lying outside, and it reduced. The mass reduced immediately. And after that, I started the oral medication. It gives very good result actually. But I have not used this Jaloka in breast cancer.
Madam, any you have told about CA rectum, no? Anything you told it is a good results you got. Uh, any specific drugs apart from whatever we are using, Shivagulika, Kanchanara Guggulu, Kaishara Guggulu, and are you doing this Basti, Matra Basti? Have you given Basti to in how about Matra Basti in that, ma'am?
No, I don't do the basti. Matra
Basti
basti.
in especially rectal CA, ma'am.
Rectal, I have not given. Because see, the growth will be there, it will be obstructing. So no need of doing any basti there actually.
What my point of view is that if you are supplying the medication to that place, Basti, Matra Basti with Taila, if you are adding some
Like you're
Guduchi
telling
Sattva,
for this
local,
5 mass basti, matra basti, no, like that you're telling. But that CA, it will not shrink actually.
okay, local we can supply medicine. That what my thought is. Is it
No. It will not help actually. So always it should shrink from inside. You have to give medicine. You should improve the immunity, and also you should strengthen up the patient and also treat the disease. Locally, we can't do anything, but just I have treated using Deloca. It gives you very good result.
okay, ma'am? Thank you so much for your.
ma'am? What about Dupana Chikitsa in breast CA?
Dupana Chikitsa, I have not done.
When wound is open and all that time,
No,
you have not tried.
I treated Rana Chikitsa I do, but Dupana I have not done. Just I will do this thing cleansing Shodhana, and I will give some of this thing ointments like I told no Panchaguna Taila I usually use. I prefer that one. I prepare ointment with that, and also Shodhana ointment and other things. So locally only. Even you can use Shatadauta Gruta also. Local application is enough. What happens? No, see, we can't see outside whether it is reaching the nearby muscles or nearby other structures. If after application, if it suppurates, then it will be very difficult to handle. But Dupa, I think you can try, but I have not tried in this scan.
In Coimbatore, we have attended one.
Padadari and gangrene cases. We do that Dupana karma. Dushtavrana. It will
Yes.
help in making it Shuddhavrana.
In Coimbatore, we have attended one this workshop, ma'am. In that, they have treated with maximum cases with Dupana also. They said that excellent results they are giving through the Dupana.
Okay. But what happens now? This thing is always we should treat the patients by giving some medications orally, and it should be such that with minimum quantity it should give good result.
Yes, that I agree. The next, Dr. Ani.
Things they will come here, especially in Bangalore. They will say we can't do all those things. We can't come daily, and planning them for even Shodhana is very difficult. But they will agree because they have such big issues, no? But they will do this Shodhana. But this sort of things, this Dupana and other small different things, they will not try.
Okay.
I think Geeta, Dr. Lalita, madam, madam, do you have any question?
Yeah, I don't have any question. I have a suggestion. Good presentation, Dr. Kavitha. Like Matravasti is helpful as a rasayana, either Kirvala Taila, Mahanarana Taila were given in JMC. They should send patients from Kidwar. So in chronic myeloid leukemia and all, no? Like if at all we give the basti like once in 2 months, like that. So the patient will be able to live for maybe 1 more year, like that. They were told that his lifespan is only 2 months. So we have tried in JMCA, we have tried that in especially Matra Basi with Kshiravila Taila and Mahanaran Taila is good. As a rasayana to postpone the lifespan. That's one of the things. I wanted to say that.
I was saying that Matra Basti in CA rectum, but in ovarian cancer and in CA cervix, you can do Matra Basti. Will give good results.
Yeah, in rectal cancer, of course, it's difficult. I think it's not possible. Other cancers, yeah.
Matra Basti in a smaller dosage, we can try that. What I think, because we have one case of a CA rectum where it is in last stage, but along with Guduchi Sattva and Sasraputi Abraka Bhasma, little quantity of Matra Basti we can try. That what thing is going in my mind. That's why I asked this question actually.
So where the growth is there, no? Like it's the superior part or the inferior part, that also depends, no? Yeah.
Yeah.
Is it been surgery? Surgery has been done, or is it taken
No,
any other?
madam. It's a fresh case, but it's the last. It's in a 4th stage. That was the question. So not able to, aged person also not able to do the surgery. So we can handle, we can give this, but Jalokachana definitely I will try. Thank you so much.
But it bleeds and touch.
Sorry, ma'am.
It bleeds and touch.
No bleeding, ma'am.
There you can do that.
No, if I go back to the old memory in JMC, one of the student was, I think,
Yes,
not to say that Murali was suffering from CA,
ma'am.
CA rectum, and it was diagnosed as what is it, Raktapitta, some rectal bleeding like that, and finally it was diagnosed as CA rectum, and no way he passed away. If it was to be identified earlier, diagnosed earlier, it would have survived, I think.
No, ma'am, it was noticed. I also heard that because when we were doing our PG, GMC time, that time patient was in that stage.
Yeah, he finished his housemanship.
Yes,
he had this one bleeding per rectum, and it was diagnosed as some what Gudagata Raktapitta, whatever rectal bleeding. Then they gave the treatment, and nothing happened. And finally, it was CA rectum. Maybe it went to the last stage. It happened like that. But yeah, that's the thing.
Maybe, ma'am. Yeah, ma'am.
Yeah.
Thank you so much, ma'am.
Yeah.
Thank you.
Hello.
You could able to hear? Hello?
Yes, sir. Yes, sir.
Yes, sir.
My conclusion is, suggestion and all things is, if anything is geriatric oncology, that is above 70, 75.
Sir, your voice is not clear, sir.
Hello.
Now I am able to?
Yes, sir.
Yes,
Vivek
yes,
sir is Kavitha madam husband. Yes, sir.
You are able to listen, madam? Audible?
Yes, sir.
Yes, yes.
Please go ahead, sir.
See, if it is any geriatric oncology case is there, that means geriatric means above 70, 75 patient is suffering from cancer, and it is not indicated for the surgery. Because most of the time it will not be only primary tumor, along with primary there will be metastasis also. In that kind of time, so anything like Madam Lalita Madam was telling, we can try all Rasayana Chikitsa, and we have to do Vata Shamana, Pitta Shamana, because when the Pitta increases also, there will be metastasis, Vata also metastasis. So we have to control the doshas and give some nourishment, Rasayana Chikitsa. So, if it is a terminal case, that is stage 3, stage 4, then any of our treatment we can try. But if it is youngsters are getting cancer, and if it is only primary, it is not a metastasis. Better not to waste the time giving our treatment. If it is indicated for surgery, surgery can be done. It is better to go for resection of the tumor, and they will do anastomosis, end-to-end anastomosis. Afterwards, we can start our Ayurveda treatment. Maybe Rasayana Chikitsa, tumor regression, in order to avoid the recurrence, to improve the immunity. All those things we can make. So that's why it depends on stage and depends on the requirement. And many patients who are not indicated for surgery because of the comorbidities when they are 70, 75. So we have many patients like old age patients. They will have some cardiac issues. They will have some pulmonary issues where anesthetists will not give fitness for surgery. In that kind of geriatric oncology, definitely Ayurveda has got a good role. So all of our protocol we can include, and we can give a good quality of life.
Okay, sir. Thank you so much.
Yeah, in I think Shalya department, Rudraksha Rasayana was done. I think no, JMC. I think Dr. Vijayendra. I think it was Rudraksha Rasayana. Dr. Vivek.
Yes, madam. I think it's Rudraksha.
Rudraksha Rasayana. He used to go to Kidwa and give to the patient. Maybe it is which type of CA, I don't know. I think breast CA only, I think.
Madam, which reference, ma'am? Rudraksha Rasayana?
See, reference, I think if you go to, sorry to say that.
I will do them, ma'am.
Yeah, please. As my memory goes back, it was Dr. Vijayendra carried out that work when I was the PG teacher, and Jaishri madam was the co-guide, and I think Shisagar sir was there. I think it was Rudraksha Rasayana. The content, Rudraksha was the main content. Other this thing, I think, other references, maybe, I think, I don't know. By Shajaratnavadi, what he has taken, I don't know. You can refer the thesis, it's there in JMC, surgery department, Mishala department. Dr. Kavitha, Dr. Kavitha and Dr. Vivek will be knowing much better, I think, about this. That is the Rudraksha Rasana. He prepared that and in the college, and he used to go to Kidwa and give it. I think probably it is breast CA, I think. Yeah, a dissertation work was carried out. Yeah.
Yeah, yes, madam. In many Vyadhi Pratyanga Rasayanas we have. For example, we can give Ballataka Rasayana.
Yeah, Ballataka
like
Rasayana. Yeah. He had selected Rudraksha Rasayana. Reference, I think, I don't remember. You can, think you can try to get it. Yeah.
Yes, madam.
Yeah.
Thank you, sir. Thank you, ma'am.
Hello. Hello. Am I audible now?
Yes, Dr. Ni.
Hello.
Yes, Dr. Ni.
Yeah.
Hello.
Yeah. Right. I got disconnected. I'm really sorry about that. Yeah. My question to Kavitha ma'am is that in your practice, what have you observed? Like usually they say ladies who are breastfed, uh, they usually do not get cancer. So what's your comment on that? How many cancer patients have you seen who have aptly breastfed? And second question is, what is your take on the ladies who take chemical or hormonal contraceptive pills? So what is the incidence of cancer in those ladies? And one more thing is, nowadays we have a lot of men visiting the gym and they're taking steroids for the muscle growth. So what is the incidence of breast cancer in men compared to women because of the change in lifestyle and the intake of steroids they take in gym?
Dr. Ani, I think madam has answered all this during the session itself. Right, ma'am?
Okay.
Yes, yeah, she's answered most of the questions. Yeah.
Okay then. Yeah, I
Any
think
other
I
question?
had some disturbance. Maybe
Yes,
I missed out
yes.
some portions. Okay.
You'll get the recording, Dr. Nee. Okay.
Yeah. Thank you so much, and thanks to Gurukul team for bringing in the speaker, because she's my teacher, and it's after 15 years I'm hearing from her. Thank you so much, Gurukul team. Thank you
Thank you.
to the
Thank you.
speaker and to the whole team. Thank you.
Thank you. Thank you.
Uh,
Any more questions?
I have a patient in the clinic.
Okay, ma'am. We are not going to take much time. We'll give the vote of thanks. I'll call Dr. Archana madam to give the vote of thanks. Bear 5 more minutes, ma'am. Please.
Yeah, okay.
Good evening, everyone. Actually, to be very frank, it was a very enriching experience because it had theory in it, practical in it, and patya. And she was so confident while she was telling that just follow this and you will see the result. It was so confidence building, ma'am. Actually, we are very grateful for you to be so confident that now with your wonderful slides, with that confidence in your talk, and also with share your experience, we have got that confidence that we can handle these cases very well with classical yogas and rasayanas. Thank you very much for giving your precious time to us. Thank you very much, and hope to see you in future with many more such successful cases, ma'am. Thank you. And I would like to thank our founder, Dr. Shakuntala Patil madam, for giving us this platform where we can get insights from stalwarts in the field. And it is indeed a blessing, ma'am, to have you. Thank you very much for this platform. And I take this opportunity to thank all the Vaidyas who have made this session a success. The effort has started a long back, so we see only few faces today, but I would like to thank all Vaidyas for the efforts. And without audience, no program gets recognition. So I'm grateful to all Vaidyas for being a part of this seminar. Hope you have so many things to carry from today's seminar, and you'll be confident just like us. How much confidence we have got. Even you have that confidence in you now, that in your practice you can adopt all the things what madam has shared. Thank you one and all, and have a great evening. Thank you.
Thank you very much, madam.
Thank you, Dr. Archana ma'am. Thank you once again, Kavitha ma'am, on behalf of Ross. Okay, we'll see you in the next seminar again.
Actually, by Tadvidya Sambhashana, we can enhance the knowledge, and by sharing, we will also improve our knowledge also. So it's good to share the knowledge with you all.
Yeah, ma'am. One more thing I have not told in this thing. We have 2 classes in our this Ross team, where we do only one Vega yoga. We will take on Monday class. In the night 9 p.m. we will take, and it will usually last for 2 to 3 months. Only one yoga. Gandhaka Rasayana now it is going on. Like that Thursday class, it's on that Gandhaka Rasayana. The class is led by Dr. Savitri madam, and Archana madam is leading and sometimes Akshay is leading the classes. They are doing actually wonderful class, ma'am. And Thursday, 3 of us are leading and reading, Manjula ma'am, me, and Vishwanath sir. That is purely an cancer. Now rectal, this renal carcinoma is going on. So there we have got lot of Tadvidya Sambhashana just now we had, no ma'am. And many eminent by the senior gurus will be joining, and they are sharing their experience, guiding us. And many junior Vaidyas who are having enthusiasm in learning, they are asking so different questions we never thought of. So it will be beautiful.
Gandhaka Rasayana in CA breast with some.
Super, ma'am.
Wow. But I couldn't get any good results actually.
Okay, ma'am. But in infectious condition, what we are seeing from top to bottom actually, from Padadaha to Netradaha, and even this thing, anywhere Daha, Gandhaka Rasayana should be used. In last class, what we are discussing, Daha for what? All those things.
Gandhaka Rasayana is good even in itching. When a patient comes to you saying itching, after itching they will have Daha. Okay, so after scratching they will have Daha. So in such cases, you can introduce that Gandhaka Rasayana.
Even
Yes,
Padadaha, Netradaha, wherever Daha, you have to give Gandhaka Rasayana. That was
But you should be very cautious while using Gandhaka Rasayana. Many patients will be have side effects. They are allergic to sulfur.
that's
Always ask for any allergy. Then you
Yes.
have to give. Sometimes after giving
Agreed.
Gandhaka, come to know.
Agreed for this one.
Sulfur reactions, you should always ask patient whether they are allergic to any sulfate compounds. Then after that, you have to always give it.
Yes, ma'am.
Okay,
Thank you so
ma'am.
much,
Thank
ma'am.
you. Thank you so
Thank you
much.
so much, ma'am,
Okay. Okay, ma'am.
for your
Again, the
actually.
last group, stay over here.
Yeah, please.